are going to present simultaneous contralateral vestibular schwannoma and glomus tumor of the temporal bone, a case report.
Okay, so that's going to talk about the topic objectives for this presentation. We're going to go ahead and be able to differentiate and identify between a vestibular schwannoma and a glomus tumor, explain the causes and why they happen and the treatment involved, talk about the interprofessional practices, and understand the test results between the two. So let's go and talk about vestibular schwannoma, a quick overview. So vestibular schwannomas actually originate from the Schwann cells of the 8th cranial nerve. 80 to 90% of them are all at the cerebellopontine angles tumors, and most of them are unilateral. Bilateral ones are usually because of neurofibrosis type 2. And so almost all of them, or the type 2, almost 20 vestibular schwannomas, per 100 million are diagnosed each year. So it's not as common. They're usually benign and they're slow-growing tumors. Whereas the glomus jugular tumor is actually part of the temporal bone, and that's located in the skull, which may affect the ear, upper neck, and base of the skull, and all the surrounding vascular areas and nerves involved. And so, this part?
Yes. Glomus jugular tumors are slow-growing benign tumors, which can be locally aggressive. These tumors originate from the paraganglionic cells in the adventitied of the jugular bulb. The glomus jugular tumors are rare, with an annual incidence of 1 case per 1 to 1.3 million. 4 cases of vestibular schwannoma and simultaneous glomus jugular tumor have been reported in the literature. 3 of the 4 reported cases presented with ipsilateral vestibular schwannoma and glomus jugular tumors, while a single case had a vestibular schwannoma and contralateral glomus jugular tumor.
Okay, so the interprofessional practices that are involved are usually the audiologist who goes ahead and do the hearing test. And so with the hearing test, we know that we're going to do pure tones, otoscopy, tympanometry, acoustic reflexes, whereas the ENT is actually going to go ahead and notice, do some imaging. They're going to go ahead and perform surgery if necessary. And a neurologist especially is going to be involved if we have detection of the glomerulus tumor, which is really important because in the temporal bone, we do know that there's a lot of vasculature and nerves that are involved, whereas in the schwannoma cells or the vestibular schwannoma tumor, it's usually just the 8th cranial nerve. And so what we're going to do for this case report is we're going to go ahead and talk about the vestibular schwannoma, while there's also a simultaneous glomus tumor, which is really rare. And this is actually the second case to be presented with a contralateral tumor.
All right, let's talk about the case history. So the patient, who is 69 years old, female, presented with a long history of bilateral hearing loss and a 2-year history of left-sided pulsatil tinnitus. The patient also suffered from the itching of the left ear canal and mild vertigo. However, she denied any middle ear infections, ear discharge, or ear pain. And automicroscopy revealed the presence of a pulsatil purple-colored middle ear mass in the anterior inferior quadrant of the tympanic membrane of the left ear. The right ear had no visible abnormalities. So in the assessment, due to the mild asymmetry in the pure tone audiometry and the pulsatil tinnitus in the left ear, including the pulsating purple-colored mass, the patient was subjected to the magnetic resonance imaging. The MRI revealed a right-sided vestibular schwannoma of 8 millimeter and left-sided, almost purely glomus jugular tumor of 18 millimeter. After the diagnosis, the patient went into watchful waiting with annual follow-up MRI. And in this image, we see, could you go back? previous slide. Yeah, and in this MRI, we see coronal magnetic resonance imaging that demonstrates a right-sided vestibular schwannoma, which is shown with short arrow, and a left-sided glomus jugulare tumor, which is shown with long arrow.
I'm so sorry, guys. My computer is having technical difficulties.
And 2 years after the diagnosis, patient stated that her hearing gets worse and her vertigo symptoms shows a progress. And they performed pure tone audiometry test, and audiogram showed bilateral hearing loss, which suggests a right-sided sensorineural hearing loss and left-sided mixed hearing loss. And speech discrimination score is 76% in the speech audiometry test speech recognition test revealed 76% in the right ear and 88% in the left ear. And then in the caloric test, they found that there was a unilateral weakness of 81% towards the side of the vestibular schwannoma. And MRI results showed glomus jugulare tumor was stable. However, the size of vestibular schwannoma had increased from 8 millimeter to 12 millimeter. So as a treatment of the vestibular schwannoma, they performed suboccipital retrosigmoid surgery with intended hearing preservation and the total removal of the vestibular schwannoma. So I just want to give some information what is the surgery. So during this surgery, a section of the skull is removed behind the ear to access the tumor and nerves. Acoustic neuromos cause hearing loss, ringing in the ears, and dizziness. The goals of this surgery are: first, maintaining facial nerve function; second, preserving hearing in the affected ear; and the third, removing the tumor. Just to have some background about the surgery.
Okay, so let's go and talk about the discussion. So what the authors found was that both the vestibular schwannoma and jugular tumors, although rare and benign, they commonly present with similar symptoms such as hearing loss. And although they are from different origins, they are subject to similar management, observation, radiotherapy, and surgery. But with the jugular tumor, we saw that no growth was observed, whereas the vestibular schwannoma, there was growth after 2 years, and because of that growth, there was a need for active intervention. And so the patient did choose to go ahead and undergo surgery. Initially, her hearing was the same, it did not decrease. However, afterwards, we saw that there was a progressive hearing loss, and because of that, she was fitted with a cross, and she actually liked it. She didn't have any complaints or want to change anything. And so right now she's under it's kind of careful observation just to go ahead and make sure that we're waiting for the regime of the jugular tumor. And so far there has been no change in observation of the tumor during the last 5 years. And so this is a really unique case because it's the first attempt to actually accurately show the audiovestibular contradictions between both the vestibular schwannoma and the contralateral jugular tumor. And there has been no previous cases of these of the vestibular schwannoma and the left contralateral jugular tumor, which have been managed with surgical intervention and a conservative regime.
So as a conclusion, even though vestibular schwannomas and glomus jugulare tumors are pathophysiologically different, they are similar in terms of symptomology, growth pattern, diagnostic process, and therapeutic strategy. So based on this case report, vestibular evaluation demonstrated unilateral vestibular weakness toward the side of the vestibular schwannoma. So this can actually be used for clinical discrimination between these two lesions. So it is our preferences, and thank you.